Hi there, my name's Sam, I'm from KeepaBeat and I'm here to talk to you today about defibrillators. Why? Because one of the mums that did our session last night kindly went on to the Ware and Hertford mums group this morning and said, where are all the local defibs? And it's brilliant. She's growing awareness about defibs and everyone chipped in telling us all where the defibs are. So I just thought I'd back that up and just have a very quick chat. Just let you all know about defibs, anyone can use defibs, how to use defibs, what they look like, that sort of thing. I've got my little one with me again, so she's going to play my casualty in a few minutes. But very quickly, some facts. Using a defib is quite scary, and especially if you have watched the likes of hospital programs and casualty and things like that, we kind of assume that we're going to have these paddles and all sorts. And defibs actually outside of a hospital are really easy to use because you can't get them wrong. A lot of people think defibrillators restart somebody's heart, and they don't. They stop a heart. So right now, if you imagine this is my heart's pumping normally. If you put a defib onto a heart that's pumping normally, it won't work. It won't allow it to work because it doesn't need to do anything to that heart. If you put it onto somebody's chest and their heart had already stopped completely, there was nothing else going on, it can't work because it can't stop something that's already stopped. It will only work if the heart has gone into a funny rhythm. Now, it doesn't matter to you what this rhythm is called, but ultimately right now the electrics are sending the heart into a quivering state. Now, while my heart is in this quivering state, it's not pumping oxygenated blood around the body. The electrics are not following their normal pathway and making the heart contract how it should. In fact, right now, the electrics are just all going crazy. And I can't tell you how long this will last for because it could be seconds, it may be a little bit longer, we don't know. So if you then put a defib onto somebody's chest and their heart is in this mode, it will deliver a charge which stuns the heart into stopping. All the electrics that were doing this have stopped. They now recharge and hopefully start that heart back into a normal rhythm. Now, it might work on the first shock, it might be the second, third shock, it might not work. But having a defibrillator and getting it onto your casualty's chest as soon as you can gives them the best possible chance of survival. In fact, for every minute that you delay getting a defib onto somebody's chest that's in cardiac arrest, their chance of survival drops by up to 14% per minute. So right now, if I went into cardiac arrest and someone was here with me and they dialed 999 and they started doing CPR on me and the ambulance arrived within its target time, let's say they took 7-8 minutes to get here, and then they used their defibrillator. So everything really has gone as well as it could do. I've got around about a 38% chance of living. If I had a defib here and it went onto my chest within 3 minutes, I've now got a 74% chance of living. Obviously, this isn't set in stone. This was a survey that was done a few years back. But the point is that for every minute that you delay getting that defib onto your casualty's chest, their chance of survival can drop by up to 14% a minute. So I want you, if God forbid this ever happened, if you are out and about, always ask for a defibrillator. Don't be scared by them. Because if you put it onto somebody's chest that doesn't need it, it won't work. If it tells you that they need it, press that button and give them that shock. Now, defib units, they come in lots of different shapes and sizes. Some have adult and child mode, some have adult pads and child pads. But if you're not sure, just follow the instructions of the unit. You can use a defibrillator on anybody. And there are some safety precautions, which is why it is good to have the training. But ultimately, like I said before, right now, if you're in the scenario of it's you, a casualty and a defib on the wall, just follow the instructions. Use it as best you can and hopefully you'll be backed up by the emergency services as quickly as possible. Now, very quickly, defibs, they like I said, they all do come in different shapes, different sizes. The public access ones that are put in, especially that are in phone boxes or train stations, they are there for anybody to use them. So if I could now have my casualty, so no, don't move it, it's fine, leave it where it is. Okay, a bit of a wobble there. Right, Rubes, come and sit down, or come and lay down for me, darling. Lay down. That's it. That's it. Lay down. And wiggle over so that they can all see you.
I'm going to go on.
That one. Okay, green spot. So pop your head on the green spot for me. And lay on your back. Good girl. Right, okay, so Ruby's going to be my casualty today. And for a few reasons, I'm not normally, if I had a casualty in front of me, I would remove clothing, I would be pulling the backs off the stickers and sticking them onto the casualty. She doesn't like the stickiness or the cold, which is fair enough, so we're actually just going to do it on her clothes. But obviously in real life you would need to put these onto bare chest. So I've walked into the front room and I found Ruby on the floor. I try and wake her up. Now first of all, just so that you can all see, just move her down. I try and wake her up. So hello, can you hear me? Can you open your eyes? Hello? If I don't get a response, I need to check for breathing. I pop the hand on top of the head, 2 fingers underneath the chin, and I do a head tilt, and I look, listen and feel for no longer than 10 seconds for normal breathing. If she isn't breathing normally, I then would do 999 on my phone and activate your speakerphone so that they can hear exactly what's going on. And if you have got a defibrillator, luckily I have mine right next to me. I'll find your sticker in a minute, darling. I turn the defib on. Sleeping lines. I cut clothing off.
Emergency medical services now.
And it's telling me what to do.
Pediatric mode. Follow the voice prompt calmly.
Right, I'm in paediatric
Remove
mode.
clothing from chest and stomach.
Okay, so cut
Rip
clothing off.
if necessary.
I'd rip it off if I needed to. And I just stick the pads on.
Take out the pads from the bottom of the device.
Now,
Tear
depending
open
on
the
the
pad
size of
packaging.
your casualty, if you've got a small child, then it's best to go pad on the front of their
Look
heart
closely
and
at
then
the
one
picture
on the
of
back
each
of
pad.
their heart. But it depends on
Peel
the size
off
of your
the pad
casualty. If you've
labelled
got a lot of
one
space,
and stick
over
to
4
the
finger
bare
space
skin of the
between, then we
patient,
can actually keep
exactly
them one
as shown
top,
in
one
the
bottom.
picture.
Right, as soon as
off
the
the
pads
pad
are on,
labelled
it will
2
start
and stick to the bare skin of the patient.
analysing
Exactly as
your
do not
casualty.
touch the patient. Analysing heart rhythm. Shock advised. Stand clear.
Okay.
Press the flashing orange button.
So it's telling me
now.
that I need to
Deliver
shock.
shock
It is just a
now.
training unit, remember. Okay, I'm shocking, clear.
Shock delivered.
And then follow
Begin
your voice
CPR
prompts.
now.
So hand onto
Press
the chest
flashing
and then I
blue
would start
on the
my
button
compressions.
for CPR voice prompt. First.
And it tells me what to do. Now luckily for me, my casualty is alive. And has been fantastic. Well done, kiddo.
System shutting down.
Shh, don't tell everyone our tricks, but yes, you can have a few more sweets. So I hope that this session, or that this little video does give you a little bit more awareness. If you didn't know about defibs, they really are life-saving bits of kit. They really are amazing. If you can afford to have one at home or in your workplace, get one. Because this is what you want. If a cardiac arrest happens, this is the bit of kit that you want at your fingertips. And for the majority of people, especially if you're at home, for the majority of people, you are hoping that the ambulance service can get one there as quick as they possibly can. Which is why we are getting more in telephone boxes and getting them in boxes outside schools, because we want them to be easily accessible to all at all times. So I hope that you found this interesting. If you've got any comments on it, then please let me know. My tricks of doing filming with a 5-year-old have now been exposed. Please. Over and out.